Ladies and gentlemen, welcome to the Drug Index. Today we are going to see Paracetamol. Who knows that? Let's see and what you can say about this. That's far too complicated to say. So where you can call it actamenophen, or if you are from US or Japan, or paracetamol if you are from British or from the rest part of the world. Paracetamol is much easier to say, and we are sticking with that today. Now, it's a really common Alzheimer's painkiller, and you might also know it by its common brand names like Tylemol, calpol, or Panadol. Who knows it by those names? Why do we need it? Why do we need paracetamol? Why do we need paracetamol? But let's use paracetamol as we said we are sticking to it. Why do we need it? Well, it's a really awesome painkiller, and step one of painkiller. It's also good at treating fever because it reduces your body temperature just a little bit as well. It's so good, in fact, that's the most commonly used painkiller in the world and is on the WHO list, WHO, for essential medicine. Now, I mentioned the painkiller. Who knows about that? That's a concept from the World Health Organization from about 1986, where they said these are the painkillers you start on, and then if they don't work, and then this, so on and so on. It's pretty good concept, and we still kinda of use it today. Not that I said add it, that's the key to good pain relief. So often painkillers are additive. You always look to start simple and then you add others in over time. You might ask yourself, well, really, how does paracetamol work? Well, we don't actually know for sure. That's the truth. We have a couple of guesses, but in order to explain how painkiller works, I probably need to explain a little bit about pain. So, what's pain? What is pain? Well, you have all had it. It's an unpleasant sensory or emotional experience associated with actual or potential tissue damage. Now, the degree of your pain is not just the pressure, it's also things like personality and emotion can go into it as well. But awesome, pain keeps us alive. It stops you from dying. You figure it out with nociceptors. That's the fancy name of the receptors which are responding to things, and you have a ton of them, and loads of them work in lots of different ways. Some respond to pressure and hard pressure, soft pressure, so to heat, to cold, to spicy, and so on. When a receptor is activated, it shoots off a signal to your spinal cord. When that happens, one other there is a reflex which tends to remove your hand or something else away from the pain, and it shoots off more signals to your brain, and your brain perceives the pain and turns the signal into an experience. Now, paracetamol probably works centrally in the brain and the spinal cord, activating pain-inhibiting pathways, blocking receptors, which trigger pain signals. But like I said, we are not entirely sure of how it works. After seeing why we need this and how it works, tell me in comments what might you predict is the side effect of paracetamol. Well, it can cause nausea, some pain, but essentially it's a pretty safe drug, actually. That is when it's taken in the right dose. Overdosing paracetamol is extremely dangerous. It leads to acute liver failure. If you don't catch that early, sometimes even if you do it, lead to extremely unpleasant symptoms and even sometimes death. It's worthy pointing out that some people have had acute liver failure just from merit overdose. It's not like they have been like chugging the bottle or anything. They have just taken a few doses too many. Often maximum dose of an adult is about 500 grams a day. Don't go over that. And another word of warning, we see pretty commonly in hospitals that some drugs contain paracetamol, and you might not know it, but it leads to accidental overdoses. A real common drug is calpol. That's stronger painkiller because it contains an opioid called codeine, but the co in Codamol is paracetamol, and some people don't know that. Did you know that? They take paracetamol as well, effectively doubling their dose. So don't make this mistake. But look, as always, if you are feeling bad or you are not feeling right when you are taking a drug, just talk to your doctor. Now on the Greek stuff, so goodbye. Most of you pray, but do not leave without subscribing and liking. Welcome to the Drug Index.